Hello everyone, this is Dr. Lakshmi Kalbande. I am practicing as a consultant obstetrician and gynecologist in Cloud9 Hospitals, Pimple Saudagar, Pune. First of all, I'd like to give a short introduction as to what actually is epidural analgesia or epidural anesthesia. Epidural anesthesia is a very integral part of labor anesthesia. So what we do is we put a small needle and a catheter through the spinal cord of the laboring woman and push some kind of lignocaine or a local anesthetic through the catheter, and hence we sort of partially provide analgesia to the lower half of your body, starting from the umbilicus and down to the feet. So what that does is, so the labor contractions that you feel so intensely, the intensity is reduced by up to 70 to 80%, and the journey from start of the labor pains to the end of the delivery becomes much more comfortable for the patient involved and also for the attenders involved as well. So coming to pros and cons, the biggest pro is that the comfort of the patient is highly increased, because there is not so much of pain and discomfort, that the periodic contractions will happen, and the intensity will be reduced by 70 to 80%. So the patient will be far more comfortable and will be willing to go through the process of labor, as we say, instead of just demanding for a C-section because unbearable pains are there and not able to tolerate the pains. Another pro is that mostly the relaxation of pelvic muscles happen after giving labor analgesia or epidural, as we say. So the baby's head, if it is not coming down for some reason, the position is not correct, it might also help for the baby's head to come down because of the relaxation of pelvic muscles. When we come to cons, so the biggest con that people say that the delivery time is second stage of labor, what we say, that is increased. So what is second stage of labor is after full dilatation of the cervix till the time of the delivery of the baby. That is what we generally call as the second stage of labor. So that duration is increased because the rotation of the head is kind of affected with the epidural anesthesia. It might be delayed. It will not be any abnormality. It's just a little bit of delayed time. So that we have to take into account when we counsel the patient for labor analgesia. And we can't unfortunately give any anesthetic drug once you have fully dilated, because the process of pushing will start soon, and unless until you feel the contractions, you will not be able to push fully. So that is one con, that for the half an hour at the last end of the delivery at the second stage, we won't be able to provide you with that much of an anesthesia or pain relief. So that is also the biggest con. Another con is that along with the extension of the duration of labor, sometimes it is observed that the fetal heart rate might show erratic patterns, like it may slow down, and it might, have tachycardia. So very fast fetal heart rate or very slow fetal heart rate. For this, the obstetrician is usually very concerned, and hence we always keep the laboring patient who is under epidural anesthesia under constant vigilance and constant monitoring. The monitoring also is done by an anesthetist, an obstetrician and a staff nurse who is trained to handle any complications pertaining to labor analgesia or epidural anesthesia. So it's completely safe, but definitely, as with any procedure, there are particular pros and cons that we have to take into account and counsel the patient accordingly.